Hello everyone, we are coming to you today from the new look and newly renovated Younker Rehabilitation Outpatient Services Gym. It's a really unique space for our patients and their families. My guest today is Maddie. She's a therapist here. And Maddie, why is this service in this space so unique to our patients?
Well, it's one of our 3 clinics in Des Moines that has occupational therapy, speech therapy, and physical therapy. And we also work very closely with our physicians, our physical medicine and rehab doctors. We have some new equipment, some of the same equipment, but a lot of the great skill that our therapists have. A lot of people are familiar with physical therapy that helps you work on your mobility, your balance, maybe pain or injuries. Not as familiar with speech and occupational therapy. Speech therapists work on your communication, your language, your thinking, your voice, swallowing, and occupational therapists work on anything that has meaning. It might be day-to-day activities like getting dressed and bathing, or more advanced things like cooking a meal, or even evaluating your driving.
Awesome. Well, can we go in and take a look?
Let's check it out.
Okay, Maddie, our first stop is the Seating and Positioning Clinic. Why is this space important and what's offered here?
Well, this space is unique to this clinic, and we work closely with our physical medicine and rehab physicians to find the perfect piece of mobility equipment for each patient. So if you come with me this way, we can show various types of manual wheelchairs with different kinds of cushions as needed for everyone's pressure relief. This one's called a Roho cushion, has different air-filled bladders that allow you to just kind of float on top of it. If we have any concerns with skin integrity or wounds, we're trying to decrease any of those risks and make sure that everyone has exactly what they need. We also have a bunch of things loaned out by our great vendors so that someone could try out any sorts of power mobility and make sure that it's right for them. So Kimber in this chair has many different features, including elevating the leg rest, reclining, tilting, to again address things like comfort, like skin integrity, avoiding wounds, and just make sure that every wheelchair is perfect for the person that is needing it. We also do evaluations called pressure mapping to again look closer at skin integrity and avoiding wounds from someone who's in a sitting position a lot of the time.
Okay, Maddie, step 2, the car simulator. Why is this important? And it's a really important part for our patients to get back to their normal life.
So if someone has been in the hospital for a long time, often their mobility or their movement is impaired. So we're going to practice getting in and out of a car, which is the way that most people get home from the hospital. So this car is customizable. You can raise the height of it with this hydraulic to the height of someone's car that they might actually have. You can adjust the seat position, and we can have Kimber practice getting in and out. So when you're going to go to sit, I want you to make sure that you're turning first and sitting and then getting your legs in. Okay. So it's a wide opening, about as much as a 2-door, but if there is, again, you can move the seats back, you can elevate the car. Yep, sit and then swing those legs in. So if someone was in the hospital, even for a knee replacement, a stroke, a brain injury, anything that's going to affect your mobility, we can help train someone to get back and moving and doing the same things they were before. There we go. Does that feel about right? Safely in and out.
Okay, Maddie, our third stop is the Balance Master. Balance is obviously the word that we all know and see, but you guys are looking for so much more with this device in our patients.
So oftentimes our therapists will use this device for someone who has already had falls and is concerned with more falls, someone who might have had a stroke or a brain injury, or someone who might have had an amputation and they're trying to work on just their center of balance, center of gravity. So we'll get this started, show you what it does. So Kimber, in this condition, you're going to have the floors are going to move and the walls are going to move, and you're just going to try to keep yourself in the middle. So basically what we're assessing here is seeing how well she's using her vision, how well she's using her body, her legs, her ankles, her knees, her hips to help her stay in the middle, as well as what we call the vestibular system, your inner ear system to keep yourself in one position. And this is one of the most challenging, but she did well.